Knowledge 4.5 Disorders of the digestive system. Here are some commonly found digestive disorders. 1. Diarrhea. Diarrhea is a condition of an increased frequency of watery bowel. In this condition, the secretion of fluids in the intestine increases and the absorption of water from the intestine is reduced. Symptoms: watery stools, sometimes accompanied by a stomach ache. Causes: diarrhea can be caused by microorganisms, some drugs such as antibiotics, and even by different diseases. Contaminated food and water are carriers for these germs to enter the body. Prevention. To avoid diarrhea, we must ensure the hygienic conditions of our body as well as of the environment. Always wash your hands before eating meals, after using toilets, sneezing, coughing, and blowing your nose. Eat well-washed vegetables and fruit. Use boiled or purified water. Do not use antibiotics and other drugs without the advice of a qualified doctor. In case of diarrhea, immediately consult with a doctor. Learning activity 2. Arrange a meeting with a doctor, preferably a gastroenterologist. Ask him/her to guide the class about disorders of digestive system. Also, tell the healthful practices to maintain gastric health. 2. Constipation. Constipation is a condition in which a person experiences reduced bowel movements or has difficulty in passing stool. Causes: 1. Poor diet, animal fat-rich food, and low-fiber diet. 2. Insufficient water intake. Prevention. Proper exercise, fiber-rich, and good water intake can help to reduce the symptoms of constipation. One should eat high-fiber foods such as raisins, raw vegetables, salads, cereals, whole-grain bread, and fresh fruit. 3. Gastric ulcer. Ulcer takes place when the internal lining of the stomach is damaged due to bacterial infection. Symptoms: signs of an ulcer can include a burning pain in the stomach between meals or at night. 2. Pain that disappears if taking an antacid. 3. Heartburn. 4. Nausea v. bloating. Causes: 1. A gastric ulcer is caused by Helicobacter pylori bacteria. Spicy food transfers the H. pylori bacteria to the human body. 3. High stress levels also activate ulcer-causing secretions. 4. Severe side effects of some medicines also cause ulcers. Intensive cases show symptoms: a black stool. 2. Vomiting. 3. Weight loss. 4. Severe pain in the mid and upper abdomen. Prevention. The following measures can be adopted to prevent ulcers: I do not smoke. 2. Avoid spicy food too often. 3. Do not do self-medication. 4. Keep yourself calm and do not take a lot of stress. 5. Immediately consult the doctor when symptoms appear. 4. Gastroenteritis. Gastroenteritis is commonly known as a stomach flu. However, it is not the flu. Gastroenteritis is the inflammation of the gastric tract, i.e., parts of the digestive system. Symptoms. Typical symptoms of gastroenteritis include loss of appetite, nausea, vomiting, watery diarrhea, and abdominal pain. In some cases, blood in the stool may also be seen. Causes. Gastroenteritis can be caused by many factors. Some of them are a virus such as rotavirus, adenovirus, norovirus 2. Bacteria such as Campylobacter bacterium 3. Parasites such as Cryptosporidium 4. Some chemicals such as excessive lead intake via certain antibiotics. Prevention. The following measures can be helpful to avoid gastroenteritis. Plenty of clean and fresh fluid water. 2. Maintain hygiene, i.e., wash hands frequently before and after meals and use toilets. 3. Eat washed fruits, properly cooked vegetables, and meat. 4. Clean your environment, especially washrooms, toilet seats, door handles, taps, etc. 5. GERD. GERD is a long-term acid reflux. In this disorder, stomach acid frequently flows upward into the esophagus. The condition is called acid reflux. Symptoms. GERD has symptoms similar to acid reflux that persist for a longer time. These are heartburn 2, sore throat 3, chest pain 4, feeling of food caught in stomach v. Food comes back into your mouth after swallowing 6, cough 7, vomiting. Causes. Following conditions can increase the risk of GERD include obesity 2, smoking 3, delayed stomach emptying 4, certain medicine v. Being overweight increases pressure on the abdomen and cause acid reflux. Prevention. The following measures can be helpful to avoid GERD. 1. Eating small meals frequently. Avoid eating large meals. Staying upright after eating. 2. Finish eating 2 to 3 hours before going to bed. Loss weight if overweight. 3. Do not wear tight clothing around the abdomen. 6. Celiac disorder. Celiac disorder is a body reaction to gluten. In this condition, the body cannot absorb gluten but rather reacts chemically. When the reaction increases, the intestine lining damages and becomes unable to absorb some nutrients. Symptoms. The symptoms are diarrhea, fatigue, weight loss, bloating, anemia, constipation, joint pain, mouth ulcer, itchy skin, loss of bone density, etc. Causes. Celiac disease is a genetic disorder. People suffering from this disease do not have certain genes in their bodies. Sometimes, a higher number of infections in early life and certain digestive tract infections may trigger the disease. Prevention. There are no preventive measures for the disease.